If you've ever dealt with an injury, you know how frustrating it can be to bounce between different doctors and appointments. One orthopedic center has it all under one roof. And here to tell us more about it, Dr. Paul Hayter is here, sport medicine surgeon with ProLiance Pacific Rim Orthopedic Surgeons. Thanks for being here. Great to see you.
Yeah, thanks for having me.
Give us some context, a greater picture as to the work that you do.
Yeah, so I'm an orthopedic surgeon, and we deal with everything from the neck all the way down to the toes and every major joint in between. And our group has surgeons that are specialists in hand, upper extremity, foot and ankle, joint replacement, spine and sports medicine procedures. And we take care of pretty much everyone, regardless of their age, from someone who has a workplace or sports-related injury or just wear and tear.
It sounds almost silly to say one-stop shop for orthopedic surgeons, but that's good news. And you guys have a big move coming up, right?
We do, and we're super excited about it. So starting September 1st, we're going to be all under one roof, all of the services that we offer. And that includes our orthopedic urgent care for walk-ins for sprains, strains, acute injuries, as an alternative to a hospital or an ER where you have a large bill and a large waiting time. We also have imaging like x-ray, bracing, physical therapy, and our outpatient surgery center all under one roof.
Wow.
Yeah.
How do folks know when it's time to come see? I'm one of those stubborn people, you think it's just sore, it'll wear off, and maybe in 6 months if I'm still hurting. How do people know when it is time to see an orthopedic specialist?
Yeah, if you're having difficulty performing the activities you love, whether it's from pain or swelling or limited mobility, that's a great time to come check us out. And because most major insurances do not require a referral from your primary care physician, you can just call us or go online and book with us directly. Or if you do have an acute injury, you can just walk right into the urgent care.
Because of the specialist factor, a lot of people might wonder too, what happens after I come in? I come in, I get a consultation, I have a visit, then what happens?
Well, then we can tailor an individual treatment plan based on what's wrong with you. So if we need a brace or physical therapy or more imaging, it's all on site. If we happen to need surgery, we do have an outpatient ambulatory surgery center that allows you to have your procedure and go home and recover there. Compared to like a hospital-based surgery, this is lower cost out of pocket, lower risk of infection, no sick people around, and traditionally much easier parking.
Yeah.
And most of what we do can be performed there. However, it depends on the health of the patient and, of course, what procedure is being performed.
When it comes to specialists, how often do people come see you and then you say, no? I mean, do you ever turn people away and say, you don't actually need
Sometimes
work?
It's not necessarily a problem that I can help with, but I can usually help you go down the right venue of who to see.
What are the most common, patients that you're seeing these days? Who's the typical person coming through the door to see you?
Highly active individuals in my practice who injured themselves snowboarding, mountain biking, skiing.
I didn't want to stereotype with pickleball, but I'm assuming that there is a relation to the upticks of sports like pickleball and people coming in saying, I got after it.
Yes, for sure.
Yeah? So other than that, what are you seeing?
I see a lot of meniscus tears, rotator cuff injuries, ACLs, ligament damage. That's a big part of my practice.
What would you say to the folks out there? Because obviously when it comes to medicine, when it comes to seeing a specialist, most of us hope it goes away. That thing in my elbow, I think it's just going to go away. It's just tennis elbow. I've heard about that thing. It's just going to go away. What would you say to the people who maybe are just, quite frankly, intimidated or even scared to make an appointment?
I think it's hard to give up the activities you love. And so if you're having difficulty doing that, you should just come get treatment. We're not scary. We're not super mean. We don't wear white coats all the time. And we can help make you better.
On that note, I always like to ask specialists, people in unique lines of profession, what do you think people would be most surprised to know about what you do?
Just how common it actually is, and that many of us have had the same injuries that you're dealing with.
Right.
And so we can help treat you based on our experience as both a clinician and a patient.
Wow. Okay, good stuff. We love this. So for more information about what we just talked about, you can visit the website. We've got it right here on your screen. Don't be scared. Make an appointment. Thanks for being here. New Day Northwest is sponsored by ProLiance Pacific Rim Orthopedic Surgeons.